The idea that fatty liver disease only affects overweight or obese individuals is not just outdated, it's dangerously misleading. A growing body of research now confirms what clinicians are increasingly seeing in practice. You don't have to be visibly overweight to have fat in your liver. In fact, lean NAFLD, non-alcoholic fatty liver disease in people with a normal body mass index, is not only real, it's alarmingly common. And because it defies conventional assumptions about body weight and liver health, it's often missed or dismissed, leaving millions of seemingly healthy people at risk for silent liver damage. NAFLD is often thought of as a lifestyle disease associated with obesity, insulin resistance, and metabolic syndrome. While it's true that excess body fat, especially visceral fat around the organs, is a major driver, it's not the only one. The liver accumulates fat when there is a mismatch between the fat and sugar coming into the body and the liver's ability to process and export it. That mismatch can happen in people of any size. What matters most is not just weight, but metabolic health, and metabolism can be disrupted in thin people just as easily as in those who are overweight. One of the key culprits in lean NAFLD is diet quality. High sugar intake, especially in the form of fructose from sodas, juices, and processed snacks, is a major contributor. Fructose is metabolized primarily in the liver, where it can be rapidly converted into fat, even in people with a normal calorie intake. So a person who eats few calories but drinks sugary beverages or relies on processed foods can still overload their liver with lipids. Add to that low fiber, nutrient deficiencies, and frequent snacking, and the liver becomes a fat storage unit, regardless of external body weight. Another underappreciated driver is chronic stress. Elevated cortisol levels promote fat deposition in the liver, increase insulin resistance, and interfere with the liver's ability to burn fat efficiently. A lean person working long hours under high pressure, sleeping poorly, and skipping meals might look healthy, but be metabolically inflamed on the inside. Add in the effects of environmental toxins like pesticides, plastics, air pollution, and endocrine disruptors, all of which are processed by the liver, and you have a recipe for silent dysfunction. Genetics also play a role. Certain populations, particularly those of South Asian, East Asian, or Hispanic descent, have a higher genetic predisposition to storing fat in the liver, even at low body weights. This makes BMI a poor predictor of metabolic health in many cases. A thin individual with a fatty liver may have normal cholesterol and a flat stomach, but still be dealing with significant internal organ stress. The danger with lean NAFLD is that it's almost never suspected. A doctor might skip liver enzyme tests or an ultrasound in a patient who doesn't look metabolically unhealthy. As a result, diagnosis is delayed, sometimes until symptoms appear, such as fatigue, abdominal discomfort, or abnormal blood work. But by then, the liver may already be inflamed or scarred. Silent progression from simple steatosis, fat buildup, to non-alcoholic steatohepatitis, NASH, or fibrosis can occur over years, all without obvious warning signs. That's why early screening matters, even in people who are thin. Basic liver enzyme tests, ALT, AST, triglyceride levels, and imaging like ultrasound or fibroscan can detect fatty liver in its early, reversible stages. Awareness campaigns and clinical guidelines need to reflect this reality. Weight is not a shield against liver disease. Everyone, regardless of size, needs to consider how their diet, stress levels, toxin exposure, and lifestyle habits affect their liver. The good news? Fatty liver, including lean NAFLD, is highly reversible, often more so than other chronic diseases. Reducing sugar and processed food intake, increasing fiber, and eating more liver-supportive foods like leafy greens, cruciferous vegetables, omega-3s, garlic, and turmeric can help clear fat from the liver over time. Intermittent fasting or time-restricted eating has also shown promise in improving liver fat metabolism. Managing stress, getting restorative sleep, and minimizing exposure to environmental toxins further supports liver recovery. So while the mirror might say healthy, and the scale might read normal, the liver tells a deeper story, one that isn't always visible on the surface. If you're experiencing unexplained fatigue, digestive issues, or stubborn inflammation despite being thin, it may be time to look deeper. And if you're living a high-stress, high-sugar, or chemically burdened lifestyle, your liver may be struggling silently, even without the obvious signs. Fatty liver is not just a disease of excess, it's a disease of imbalance. And in a modern world full of hidden sugars, processed food, chronic stress, and invisible toxins, imbalance can affect anyone. Fortunately, the liver is remarkably resilient. With the right support, it can shed fat, reduce inflammation, and regenerate, quietly restoring balance from within. But first, we have to recognize that liver health doesn't come with a body type. It comes from the inside out.